Ever pondered the distinction between a molar pregnancy and an ectopic pregnancy? Yes, they're both rare and serious complications of pregnancy, but they're also quite different in many ways. Firstly, let's talk about location. In a molar pregnancy, an abnormal growth of tissue occurs within the womb, usually stemming from the placenta. This abnormal tissue forms a mass or tumor that can resemble a cluster of grapes. Next, let's discuss the cause. Molar pregnancies occur due to abnormalities in the fertilization process, leading to the development of abnormal placental tissue. This can happen when an egg with no genetic material is fertilized by a sperm, or when a normal egg is fertilized by two sperm. Symptoms are another way to differentiate between the two. Molar pregnancy symptoms may include vaginal bleeding, severe nausea and vomiting, an enlarged uterus, and high blood pressure or other signs of preeclampsia. Lastly, the treatment for these conditions is also different. For a molar pregnancy, treatment typically involves removing the abnormal tissue from the uterus through a procedure called dilation and curettage. Close monitoring is necessary after the procedure to ensure that the molar tissue does not regrow. In some cases, chemotherapy may be necessary. Firstly, let's talk about location. On the other hand, an ectopic pregnancy happens when a fertilized egg makes its home outside of the uterus, most commonly in one of the fallopian tubes. It can also occur in other locations such as the ovaries, cervix, or abdominal cavity. Next, let's discuss the cause. Ectopic pregnancies, on the other hand, occur when the fertilized egg is unable to reach or implant properly within the uterus, and instead implants and begins to grow elsewhere in the reproductive system. This can result from damage or blockage in the fallopian tubes, hormonal imbalances, or abnormalities in the shape or structure of the reproductive organs. Symptoms are another way to differentiate between the two. Ectopic pregnancy symptoms, on the other hand, may include abdominal pain or cramping, vaginal bleeding or spotting, shoulder pain, dizziness or fainting, and pain during urination or bowel movements. Lastly, the treatment for these conditions is also different. For an ectopic pregnancy, treatment depends on the location and severity of the condition. Options may include medication to stop the growth of the pregnancy or surgery to remove the pregnancy, often via laparoscopy. To sum it up, while both molar and ectopic pregnancies are serious complications, they involve different abnormalities and occur in different locations within the reproductive system. It's crucial for women to seek prompt medical attention if they experience symptoms suggestive of either condition. Knowledge is power, and understanding these differences can make a world of difference.